Do you have shoulder pain with benching? In this video, I'm going to go over why you're having shoulder pain with bench pressing, modifications to keep you bench pressing with pain, and 3 exercises to eliminate the pain for good. Front shoulder pain with bench is one of the most common complaints that I'll hear from shoulder clients. The answer they are given is to stop benching because it's causing pain and it's quote unquote bad for the shoulders. This is not the case at all. How do I know this? Because I'm Dr. Joey Seyforth, owner of Comeback Performance and Wellness, where we've helped thousands of people with shoulder pain with our online coaching program eliminate pain, get back to bench pressing and crushing workouts. The first thing to focus on when someone's having that anterior shoulder pain is to focus on what's actually causing the issue to begin with. So let's talk about that shoulder pain in the front when you're benching and what you're actually experiencing. So most often, this pain is brought on by the bottom position down here when our shoulder is extended. As our shoulder is extended in this position, that ball is coming forward and rubbing on a lot of those structures. This is the most common thing that people will experience when they get that front shoulder pain with bench. The shoulder is a ball and socket joint, meaning that it can move every different direction like a golf ball on a tee. It can go forward, up, down, inside, and outside, but it also needs stability or support as we're going through different motions in and out of the gym. When we have that anterior shoulder pain in the front, it's often because this ball and socket is rubbing into different tissues. We have bursa, which are fluid-filled sacs, tendons, ligaments that include the rotator cuff or bicep tendon. Basically, this ball is rubbing into all that stuff in the front, causing inflammation and irritation, and result leading to pain. Check out my top 3 shoulder exercises to reduce pain with bench pressing and provide stability to the shoulder. The first exercise is called a banded shoulder posterior mobilization. The goal of this exercise is to push the shoulder back so it's not pushing so much on those structures in the front of the shoulder and provide relief. The first step is attaching the band to the rig. Then you're going to place the band over your shoulder with the goal to have the band pulling the shoulder back. From there, you want to make sure that there's a good amount of tension on the shoulder, and you're going to move your arms in the bench press position. So bringing the elbows back and forward, making sure that you're moving through the range that feels good and not pushing into pain. Complete 3 sets of 15 of this exercise, only moving into further motion as the shoulder starts to feel good. You do not want to force this into pain because this is going to cause more irritation before you bench press. You should already start to notice some relief in the front of the shoulder as we're offloading those tissues. The next exercise is a prone I with the goal to activate the back of the shoulder. You're going to lay on the ground and you really want to relax your upper neck muscles. I like to put my head on a towel. You're going to place your arms on the ground, palms facing down. You're going to activate your shoulders and lift your arms off the ground. By keeping our arms by our sides, we're able to activate the low trap muscle and to get more blood flow and activation to the back of the shoulder. Lift arms up and hold for a few seconds each rep. This is a lot harder than it looks, especially if you are dealing with shoulder pain. If you're doing this exercise and it is feeling way too easy, you can grab a light set of weights, anywhere from 1, 2 to 3 pounds, and complete the same exact motion. You are not going to get jacked doing this exercise. We are treating this as an activation to prime the shoulders before bench pressing. Complete 3 sets of 10 with a 3-second hold at the top position. Now that we have provided mobility and activation for the shoulder, the next step is to follow it up with stability. The last exercise is called a banded bench press. This exercise is going to target the posterior rotator cuff in the back and provide stability to the shoulder that's going to help offload the front of it while bench pressing. You're going to grab a circular band, lay on your back, and put the band around your wrists. From this bench press position, you're going to pull the band apart, activating the back of the shoulder and lowering your arms into the bottom position of the bench press. As you control the descent of bringing your arms to your chest, you're going to go down with 3 seconds and then bring your arms back up into that original position. You should feel the back of your shoulders engaging and possibly burning from this exercise. This exercise is providing the stability that so many people are lacking when they're having that front shoulder pain. Typically, the back of the shoulder is a lot weaker and it's not providing that support that the shoulder truly needs. Complete 3 sets of 8 of this exercise with a 3-second lower. You should feel the back of your shoulders engaged after this exercise. Those 3 exercises done in that particular order for getting the mobility, activation, and stability are going to be huge for helping offload the shoulders, but they also might not take the pain completely away as you're bench pressing. If after doing these exercises you are still having that front shoulder pain with bench press, check out these modifications to help. The first modification is to still be on the bench, but we're going to grab dumbbells. You're going to turn the dumbbells in to put the shoulder in a less aggravating position. If this reduces your pain and you're feeling good, this is a great place to start where you can keep bench pressing and loading up the weight, but modifying for pain. If after you complete that exercise and you're still having pain, the next step is to turn into a floor press. For this exercise, you're going to lay on your back and you could either grab a barbell or dumbbells. The goal of this exercise is to limit how much your shoulder gets into extension, because this seems to be the trigger for a lot of people that have that anterior shoulder pain in the front. So we've gone over 3 exercises to help mobilize, activate, and provide stability to the shoulder with the banded posterior glides, prone eyes, and banded bench. These 3 exercises should be done in that particular order. We also talked about 2 modifications for those that are still having bench press pain after those exercises. The first one, grabbing dumbbells and putting our shoulder in a less aggravating position. And then if we're still having issues, transitioning to a floor press. Although those exercises and modifications can be extremely helpful for so many people, the shoulder issues are not completely being addressed and the work is not all the way done. The goal of a shoulder program should be to eliminate pain, improve mobility, and improve strength and stability of the shoulder in that order. The first step, though, is always establishing the root cause of why you're having shoulder pain. So many healthcare providers jump right to the shoulder when the issues can be stemming elsewhere. Once the root cause is established, then there can be a game plan built to fix it for good. If you're tired of having all this shoulder pain and you're serious about taking control of your health, then text me the word pain to 720-710-4371 to get a step-by-step tailor approach on how to fix your shoulder pain for good and get you the active lifestyle that you deserve. Do this right now so you're not wasting time with the shoulder pain and putting off things that you truly enjoy and making all these modifications with your life. Shoulder pain with sleep or daily life is not normal. You do not need to keep living with this. After you guys reach out, please like and subscribe to the channel. I'm trying to put out as much free content as I can to help you guys with shoulder pain and provide all the resources that I can to help as many people. At Comeback Performance, our goal is simple. We want to help over 1 million people avoid unnecessary imaging, surgeries, injections, eliminate their shoulder pain, and get back to the active lifestyle that they want. At Comeback Performance, the comeback is always stronger than the setback.